Hi, afternoon everybody. Welcome to the latest instalment of Ask the Exec. Very welcome you all are, and good to see a good number on the call. Tell your friends, tell your colleagues to get involved. It's really important that we have this facility where members of the exec are available to ask questions. So today we've got Julie Atfield from Mental Health and Learning Disability, Anne-Marie Newham, Director of Nursing Quality and HPs, and Sarah Furley, Director of Partnerships. Don't tell the others, but it's the A team today, isn't it? Anne-Marie is looking all stern at me. Right, so a brief summary update from me, and then we'll go to some of the questions that we've had sent in. And please feel free to put questions in the chat if you'd like to ask something, and we'll try and respond today. And sometimes we're not able to, and if we don't, we do go and ferret around and get a response. It's really important that we can do that. So in terms of headlines, you'll all be aware that from the media that the good news continues around the declining rates of COVID, new cases, serious illnesses, and importantly the number of deaths is reducing quite dramatically, actually, allied to the number of vaccinations given. I think last night it was over 33 million nationally. Which is a tremendous achievement. Within the county, we're over the 500,000 mark, so over halfway for first doses. But those of you that are numerate will realise that in total for first and second doses, we're going to have to do over 2 million in the county alone, so it's still a long way to go. The other thing of note around vaccinations is that there's still a bit of a lull in the national supply for both the AstraZeneca and the Pfizer jabs. There's an expectation that will pick up through May, but there's still a lack of clarity about that. I'm sure people appreciate the complexity of the global supply chain for vaccines. It's difficult to have full control of. But overall in a good position, really good, strong position in terms of staff who've accessed the vaccine. And just to confirm with people that there hasn't been a deadline that may have been missed. If people are, or for whatever reason, whether it's hesitancy or wanting to wait a little bit, there's still availability for staff to get their vaccines done. In terms of outbreaks, what they're contained, I think Anne-Marie was still at 4. Three. And no new ones in recent times. So a big, huge thank you to everybody that's maintaining all the rules and regulations around social distancing, use of PPE, keeping vigilant, staying safe. We're not out of the woods yet. I know I say this every week, but it's really important that we continue that vigilance. And allied to that will be the importance, I can't emphasize it enough, about lateral flow testing. I've had some feedback, as you can imagine, from some of the strong daily messages around ensuring staff get lateral flow tests done, and as important, get it recorded and loaded up into the system. We try and make that as easy as possible for people to do, but it really is, I can't stress it enough, so important for us to continue to do that across the whole of the organisation. So thank you in advance, and please pass on to your colleagues and your teams that message. In non-COVID news, whilst it's not going to go away anytime soon, we're starting to get back into business as usual rhythm, but again it's going to take some time for that, and it's really important that in terms of our priority order of things, that we take time to make sure that staff are supported, that their health and well-being remains really important and the most important priority, not just for our organisation, but the whole health and social care system. And we've got an increasing suite of support available for people, which is easy access to get information about what sort of things are around, for example, through Connect. My concern, though, is that despite our best efforts, again, people have seen in the news the massive backlog and increasing demand, not just in mental health and learning disability, but in physical health services, in primary care, which will impact across all our organisation. And we must do our utmost as leaders and people in the organisation to make sure that we can manage that as best we can. There's no blueprint for it. We've not been here before, but just to give you some example of some of the emerging conversation that's coming out from the regional teams about what's called the elective care backlog, so the planned operative procedures, cancer treatments, etc. They're looking for systems to, inverted commas, volunteer to get back to 120% activity compared to pre-COVID. So all I can say to that really is how on earth we're going to, but that's the sort of tension that's going to build, and that is our responsibility, certainly the responsibility of the executive team to manage that, to support people to do the best they can and find time for recovery and recuperation. So, for example, there's an awful lot that we're starting to pick up. We've had some conversations in recent days and weeks around discussing the annual plan and our strategy going forward. We've talked extensively with Julie and her team and commissions about the mental health and learning disability transformation programme, implementing the long-term plan. It's pleasing to hear that there's some additional national money is coming down. And this is one of the first years that actually that rhetoric has been backed up by cash in the bank, as it were. So that's heartening to see. Again, you'll be aware that mental health and learning disability remains a national priority. Our teams under Becky Sutton are working really strongly in the community arena, particularly the urgent and emergency care pathway. And again, there's a huge transformation programme underway for that. And I think both those are quite good examples of, I think we'll see this from a national strategy perspective become a period of quite significant transformation as the way the NHS services are provided and run. And the next year, 18 months is changes ahead, big time. And then just finally for me, one of the really good news stories in terms of supporting our staff is the number of nominations we've had for this year's Oscars was the highest ever. Yolanda will insert a number, which I think was over was I dreaming this, Yolanda? Was it over 400 or something? But it's been a massive response of superb interest and desire to recognise and appreciate the great work that our staff and our teams have done. So watch out for more information about that as the judging starts, and we'll be winding up to, I think the celebration ceremony is going to be on June the 10th, unless I'm about to be corrected by our Associate Director of Comms. So, Alex, that's all from me by way of introduction. Hand back to you. Thank you.
That's great. Thank you ever so much, John. And that's great news about the number of nominations. So just to add into the for the recording, within the chat, Sarah Furley had said that there's given over 620,164 vaccines in the county as of yesterday. That's phenomenal, thank you. And Anne Maria has stated that 3 outbreaks, the last one was declared on the 29th of March. So thank you ever so much. So some of the questions that have been sent in, and as John says, please do put any additional questions in the chat. And the first one, John, is what's happening with my feedback from the staff survey? Thank you.
Sorry, Alex, you caught me not paying attention for a second there. I forgot it was back to me straight away. Yeah. Great question. Thank you. So you might be a bit bored of me banging on about the staff survey. You know, I think it's the most important part of the feedback we get, because it's directly from all our people across all our services, and it's authentic. It's from the coalface, if you like, and it should really inform our improvement plans, our engagement plans, and the way that we're going to really develop and improve the organisation. So we had, in a nutshell, the answer is that we really got to mainstream the "you said, together we did," or "together we have" message. So we're starting to do a number of focus groups and conversations using a sort of co-production methodology across the organisation to identify the hotspots where it may be geographical, it may be particular teams, it may be professional groups, it may be vulnerable groups of staff where we need to put some additional work in, or some support and development to respond to the issues that they're raising. So we know, for example, don't we, that we continue to get concerning feedback from staff about bullying and harassment. There are higher rates in our BME staff. We started to do some really good and important work on addressing that, but it's important that we don't lose sight and go on to the next thing. There are some really important themes that we need to embed that's become part of the way we do things around here. So we're going to continue to do that, and we're going to continue to receive the feedback. Part of the National Staff Survey, which isn't just the questionnaire yes no, is the free text. We've had literally thousands of comments of free text, which we're continuing to go through an analysis of, to again inform the conversation, and because of the real richness of themes within that free text, which again will help describe what's next. And Alex, your team, and Yolanda's comms and engagement team will be continue to work this programme up, so it becomes again a sort of golden thread of part of what we do all the time.
Absolutely, thanks for that, John. There's a question that's in the chat from Hanny, which states that there are many available services for patients and they keep changing. When I want to refer a patient, can Connect please have the essential information that can be passed on to patients very quickly? For example, waiting times, criteria for acceptance, exclusions, information that can be passed to patients during the interview. Any thoughts, please? And I know that Mark has added that he states, I want to second the point about rapidly changing services. We too find it really hard to keep up. Even here, there has been a change. Can there be a central point of reference about this on Connect? Thank you.
Did you want me to pick that one up?
Go for it, Julie.
I love Hanny's questions because they're always spoken from the point of somebody who knows it and knows what needs to be done, really. So thank you, Hanny. And you give me a new question every time I see you, so I keep them coming is my first reply. But seriously, they are, I know, the practical things that are important when you are seeing so many people. With your particular question, I know what I think sort of off the cuff, but actually I'm probably going to take it to the Adult Mental Health Improvement Board, actually, or the Transformation Board. I'm the SRO, so I'm at liberty to put all sorts of things into that, and I'll take that, Hanny. We have got a directory of services which should be available on Connect, but it's probably not that helpful, if I'm honest. I think there are a couple of other things that are and can be really helpful. One of them is actually Recap, particularly for access to that sort of particularly patient-facing helpful information. So, you know, we've talked before about people who are waiting for psychological therapy or psychology waiting list, but to give them structured clinical things by using Recap to help them during that time that they might be waiting. So I think one of the things that we can do is think about how Recap is available to help you in that situation and what's on it and is it the right sort of thing. The other thing that I do think is going to be quite game changing is the single point of access, Hanny, where it is what it says. So in the next year, we are going to be piloting a SPA in one of the localities. But I think that SPA can be used by you and other clinicians to get people onto the right pathways. So if you're seeing somebody with complex personality disorder who could access a range of services like the new Mind service, I think that you can navigate them directly into that using the SPA. And I think those sorts of shortcuts for you and for the patients are going to be really helpful. So there are a few of the things that spring to mind. Oh yeah, we've got a Recap expert who's on the call today listening. So I think Jenny can help us with that as well. So I think there's a few ways, Hanny, that we can address some of those very practical issues on the ground. And you know, the waiting time issue, hopefully the SPA, for example, will hold all of the detail on that, and also we'll be able to book people into slots for you where that's possible. So I think there's a lot to go at through that, but if it's okay, I'll take your question in its entirety to the AMH Transformation Board, because there'll be a lot of ideas there as well, if that's okay.
Thank you ever so much, Julie. That's great. Thank you. There's a bit of a chat going on with regards to the daily briefing. So I don't know if John or Yolanda would like to come in on this at the moment. I think Catherine Concha has asked whether the daily briefings will they continue indefinitely, and Neil has stated that he hopes that they do continue, as they've been really good way of communicating, and Jeffrey has said that the daily briefings must have a factor in the improved staff survey scores. John, would you like to take that first? Thank you.
Yes, I've had a detailed conversation with Yolanda, who said that she'd like them to be twice a day. Because her team obviously are really central to collating the script and the news, etc. I thank you for the feedback. I largely agree. I think they've been I don't know why I'm surprised. I mean, they obviously came out of the emergency, an urgent situation over a year ago, and it seemed the obvious thing to do at the time. But I think they're more than that now, and I probably get a couple of emails a day from all sorts of staff giving feedback, most of it positive, but quite rightly I get some feedback. There was one person who was particularly upset about my rather strident tone about lateral flow testing, but that's the point of it, isn't it? It's we will get we are a broad church, and we'll have lots of different opinions, and it's the important thing is having the conversation and people feel able to engage in it. So we may sort of change the sort of central theme of it a bit, perhaps hopefully as the pandemic abates, and we can focus on other things and put other bits in. But I think it has sort of struck a bit of a chord. So I'm certainly expecting for it to continue daily, certainly in the sort of short to medium term. Yolanda's nodding, so
and
I've got permission.
I'm not sure that you're seeking permission, John, to be honest. But what I would say as well is somebody that's been in the organisation for only a couple of months, we get lots and lots of feedback about the Daily Brief, and even if it's negative feedback, I still consider that to be a positive thing, because it means that people feel that they can give us their views about what's right and what's wrong with everything. So it's all gratefully received, any feedback about the Daily Brief. You know, and it wouldn't be what it is if people weren't reading it, weren't taking things on board, and weren't giving us the content that they feel should be in there. So thanks, everybody.
Thank you ever so much, Yolanda. And just while you're on, I'll just highlight the figures that you put in the chat about the Oscars. Now that you've got your mouse working.
Yeah, I've got my mouse under control, Alex, now.
Excellent, excellent. So 433 nominations for the Oscars, which you stated is the most that you've received ever in the 18 years of running the event. Sorry, not you personally, but within the trust. And absolutely, it shows the link between that and the engagement across the organisation with the Daily Brief, etc. So that's fab. And that you've stated that the Oscars shortlist is to be announced mid-May, and the virtual ceremony on the 10th of June. So
that's right. And thanks to everybody that took the time to nominate their colleagues. I think it really does show how much everybody appreciates each other. You know, because the closing date this time was much shorter. The window when the awards were open was much shorter. We have worked with people. We listened to the feedback from people that had nominated before, and we did take the opportunity this year to streamline the process a bit more and to make it a bit more user friendly for those to nominate, and we've had some really good feedback about that. So, you know, we do listen to what you say, and we've made changes to that as well. Thank you.
That's great. Thank you ever so much, Yolanda. And Andrea Dickens has put in the chat just about it's great communication with all staff, which I'm assuming is about the Daily Brief. So thank you very much. And there's a question which has been put in, sent in about research, and I don't know if Mark Howells is on the chat. I think
yes.
Seen you say
is there already?
There we go, Mark.
It's like I've prepped.
So the question is, I'd like my service to take part in research studies, but don't know how to go about doing this. Where do I start?
Fab question. So there's two ways anybody can take part. The first is if they want to do research. So as a department, we put on research clinics to help people with ideas, or even if it's a simple idea of where do I start, just give us a call or email. I'll give you the email at the end. Lots of details on Connect about that as well. And the other one is getting involved with studies that are on the National Institute for Health Research or the NIHR portfolio. Again, drop us an email, details on Connect, and we can connect you up. And what we'll do is we'll work with you to understand what your service delivers. We'll go off and find the studies that are available, try and connect the dots and get us involved as a trust. And there's also, the trust has a research delivery team as well, which can work with you. And the idea is that that team essentially are the research experts, and they will take all that research effort off the busy clinicians, so the clinicians can be clinicians. And we've got a quite good process of doing that. So yeah, anything you want, go and have a look at Connect. But in the first place, contact us at research@NOTS-HC.
That's fantastic. Thanks, Mark. And we can put the link to your Connect page on here. So thank you ever so much.
Alex, sorry to interrupt. Can I just add a couple of lines to Mark's excellent answer, which is just to say to people and spread the word that Notts Healthcare has a fantastic infrastructure around supporting and doing research, and in its connection with the universities has got a national profile for some of the work that we're doing, and sometimes A, people might not know that, and B, it might also put them off a bit, thinking, oh my goodness, you know, that's way ahead of me. But all those really impressive professors and investigative leads started somewhere. And it's a great opportunity to enrich people's work, but also their CVs, their knowledge base. And it's a really, really important way of engaging patients to be part of research studies. And that can be an aspect of it that can sometimes be a bit overlooked. So as well as the specifics that Mark has identified there, I think it's a really sort of important rallying cry, really, that don't forget about research. We are good at it. We've got some brilliant people and capacity and expertise. So get involved, give him a ring, make him even busier. Thanks.
Thanks, John. Perhaps I can join the A team then.
That's brilliant. Thank you ever so much. Sorry to put you on the spot there, Mark. Just to highlight, Catherine Contra's put in the chat that the COVID vaccination bus, which is traversing the city to win hearts and change minds about the vaccination, is a great idea. Despite a bump yesterday, which will put it out of action for a couple of days, it will be back up and running soon. Sarah, would you like to say something about that?
Yeah, I was going to give you a bit more detail about that bus, because I think it's really positive. So it started last week, and like all good buses, it's got a bus timetable. And that timetable is targeted at underserved communities. So it's going to places like homeless hostels, soup kitchens, travelling groups, parks up and does its business. But what we're really trying to do is adapt that timetable to reflect what the uptake is in the community. So whilst it's got its timetable, we will adjust it as the data starts to come in. I think one of the really positive things about it is that timetable is being also driven by local community leaders, and they're telling us almost to the point of which road to go and park on. So we really get into the hearts of communities, and there's some really valuable learning. As I say, it's only been going about 10 days now, but the learning that is coming out in terms of the vaccination, I think will give us all sorts of insights going forward about how to reach these communities for other things as well. So I think it's really positive. Catherine, thanks for bringing it up, and I'm sure we'll hear more about it as we start to learn more over the coming days and weeks.
Sarah, just to add as well, just because the bus is out of action for a couple of days, the places that the bus was going to, the staff that were manning the bus are still going out to those areas and are still vaccinating. So the bus might be out of action, but the staff that were manning it are still out there and still vaccinating in those areas that the bus had planned to go to.
They're a hardy group, that group, aren't they? Nothing stops them. Nothing stops them.
That's fantastic. Thank you. I had no clue about that, so that's fantastic. Thank you. And it's and as you've said, it really is. It is a great idea, as you've said, Yolanda. And Jen Gwyve has added that this bus sounds amazing and could be used for so many other health issues to improve equity of access. So fantastic. And Jenny's added, love the bus. So yeah, thank you very much. Anne-Maria, there's been a question sent in, and John's already touched on this, just about how to record lateral flow tests and the importance of it. And I know you're very passionate about this. Thank you.
My favourite subject. I can't believe somebody would send that in. I think that was specially for me. No, in all honesty, I've got there is one new announcement. I'll try and stick it on Facebook actually later. So it's just to say that we made a decision today that all staff that work for NHS Notts Healthcare that are coming onto site can access lateral flow kit tests. Okay, so previously we've said all frontline staff working with patients. But we've changed that as of today because it's complicated. We've got a 2-tier system. So we've got some people that are accessing our lateral flow kits and some people that are accessing the pharmacy ones through local authorities. So what we're saying is that from today, all staff can access lateral flow kits if they are coming on site. And the reason I just emphasise that last little tiny bit is that we do recognise that we have some people still shielding. So some people classed as clinically vulnerable and are working from home, and some people still working from home. So I can see that they wouldn't come in to pick up the kits and do the testing, but everybody else can do that. Now, next bit, we are only at 15% at the moment. So all those people have got all those kits, thousands and thousands of kits, only 15% are putting their results in. We need to increase that. That is poor, and we will be performance managed on it. Well, it's either number 2 or number 3, but let's go for number 3. Number 3 is we are only 33 out of 40 trusts in the region. 33 out of 40 trusts in the region. That is our rate of compliance against putting our results in. Sherwood are number 1. NUH is number 5. We are number 33. You can see where I'm going with this. I am competitive. You all know that. Come on, let's do better. Now then, the other thing is that I know that some people are saying, oh, do you know what? I did do it, but I just haven't had time to put my results in. What I've been saying this week is I can recognise that. I can see that could be an issue. So I've said to teams today, services and teams today, if you can find a way of inputting your results in a better way, then come up with it. It's all right. We're not stipulating you have to do it one way. What we're saying is if you find that it's easier to have a sheet of paper at the beginning of the ward as people come on shift and say, yeah, I did my test, this is the result, and then you've got an administration person who can put all those results in, that's fine. I'm happy for people to be creative about it. I'm not saying you've got to only do it one way. It's just we've got to increase those results in. Otherwise, there's no point in this giving the kits out. There are lots of different ways of putting your results in. You can go on to Connect. You can do it via the Trust website. There's a direct link. And you can, like I said, you can submit your results on paper. So, you know, try and think of ways that suit your needs and the way that you work to be able to input better than we are now. I hope that helps.
That's great. Thanks, Anne-Maria. John's added, we don't want to be mid-table mediocrity on this.
No.
Absolutely. And Lynn Corcoran's asked a question. It would be helpful for line managers to have data on LFT inputting, as this would help them to support and manage individuals. Is that already available, Anne-Maria?
It is available. So Lynn, what I suggest is you do is go through the incident control admin web email address, go into that, and Karen Cisse can give you exactly how you access the LFT results for your area.
That's great. Thank you ever so much. And we can we can try and send some further information on how to do that. That's thank you. There's another question that's got your name all over it, Anne-Maria. I've seen information about changes to recording supervision. Please, could you clarify?
Now, look, do you know what? I love it when I get a question that I know a lot about. So I'm very passionate about supervision. So as you can imagine, as the Director of Nursing, this is really important. OK, let me just do a little tiny a couple of seconds lesson. There is clinical supervision. There is managerial supervision. And in the olden days, people would have called those one-to-ones. So, you know, one-to-ones, that's the same as managerial. It's no different. So you've got clinical, managerial, safeguarding. There are 3. I have to say, having used so many supervision systems across the country, this is one of the simplest ones there is. It's absolutely brilliant. It's got a drop-down box. You go in, you put the name of the person who's giving you your supervision or who you have supervised, and then you do the drop-down box. It's either clinical, managerial or safeguarding. Tick, yes, done. Honestly, it couldn't be more simpler. Now, what I'm saying to you is this. We have made some changes. We absolutely have made some changes. And the reason we made the changes is I realised that when I came into this trust last January, I couldn't put supervision in because they didn't recognise me as being clinical, okay? So I am a nurse, but I work corporately, but I couldn't put in because they didn't recognise me as being a frontline member of staff. So we have done so much work over the last 12 months to get it right for everybody. So from the 12th of April, what we sorted is from the 12th of April this year, all substantive staff have access to the supervision reported system. Okay, so they can go in, drop down box, they can see their name, they can see who supervised them or they supervised the other person. And then from the 3rd of May, all corporate staff like myself and anybody else that's working in corporate, because we've got loads of nurses or clinical staff that are still doing their registration, that work corporately, they can all do access the system as well. So that's the 3rd of May. And then from the 3rd of June, all bank staff, because we didn't have a way of making sure that bank staff could record their managerial and clinical supervision. Now, where the other very important, is in the olden days, a few years ago, CQC was only interested in clinical supervision. They weren't really interested in anything else, and you used to have to give them loads of data of how much percentages people had supervision. So you'd say like 88% of staff on that ward have had clinical supervision. That's what the olden days looked like. The new days today looks like the CQC are really interested in, have people had managerial supervision? Have they had safeguarding supervision? So we now have to evidence that people have access to both clinical, managerial and safeguarding supervision. Really, really important. And so therefore, staff that aren't necessarily frontline, staff that are administrative staff, but still have one-to-ones, they can now access this supervision system to say, yes, I've had my managerial supervision. Now, one more important thing. Managerial supervisions every 2 months, clinical supervisions every month. You can see I know a lot about this, can't you? Bit of passion. I've got a bit of passion around supervision. If you want to ask me any more questions, please, I'll come on next week, especially, and do 30 minutes just on that if you want. I know you won't want to do that, but genuinely, I'm here if anybody wants to know anything about it.
Maria?
Yes, Yolanda.
I just want to say that it's not just about the CQC, though. I don't want people to think it's just about the CQC. This is about how we lead the organisation and how staff feel supported in doing their jobs as well, isn't it? So.
Oh, no, that's you've put a really, really good point there, Yolanda. And I wouldn't want people to think we're only doing it for the CQC. So I'm really grateful that you've raised that. No, this is about people really dealing with very complex, difficult, challenging situations and having the ability to have supervision that actually supports them to do their day-to-day jobs. Because we are all doing very difficult jobs, and particularly this last year, some people have been redeployed. We've got bank staff, we've got people that are doing all sorts of different things that they're not used to being able to do. And that they need that chat. They need to be able to really debrief it through supervision. It's a really fundamental part of anybody's job, whether it be clinical or managerial. Thank you for that, Yolanda.
Thank you ever so much, Anne-Marie. Your passion is absolutely overflowing. It's fantastic. Thank you. And John's added it's core to professional work. So yeah, absolutely, completely agree. Sarah, there's a question that's been sent in. Can people who are fasting during Ramadan still have the COVID vaccine? Thank you.
Thanks, Alex. The quick answer is yes. So Ramadan started a week last Monday and it goes on till the 12th of May, and the British Islamic Medical Association have stated that it is okay to have the vaccine, and it doesn't break the fast because it's not nutritional. So what they also say is if you do have the vaccine and you feel unwell, it is okay to break the fast, to take medication, for instance. So that sort of month period of Ramadan is a fairly long time if you are hesitant or uncertain about having the vaccine. So I'd say please come forward if you've got any other questions, but it is okay to have it. And what we are doing is we are opening the vaccine centres slightly later in some areas, just to give more opportunity to have appointments, so that if you do want to eat before you go and have the vaccine, there are appointments available to do that. So short answer is yes, but if you have any concerns, please come forward, and we have issued some advice and guidance to GPs as well to help people make the decision and take up the offer of the vaccine. Thanks, Alex.
That's great. Thank you ever so much, Sarah. Anne-Maria, there's a question that's just been posed by Craig. Where does personal supervision come in this rather than being managed supervision? As I found old school personal supervision useful and be ring fenced so it doesn't get cancelled and not prioritised. When are we going to have team supervision ring fenced time for the team?
No, it's a really good question, Craig. And I had started writing an answer, but I'm so glad to be able to say it because I can't type that quick. So basically, personal supervision, because we don't want to add any more headings and make it confusing for people as to what different things are, what I suggest is that your personal supervision goes under the heading of managerial supervision. So just use that drop-down box when you're doing personal supervision. It depends what you mean by personal, because everybody thinks of it slightly differently. So it depends what you mean by that. But what I suggest is use the managerial heading. And then the second part of the question is when are we going to have team supervision, ring fence time for the team? And again, team supervision, I do lots of team supervisions actually, and I either do them under clinical supervision or managerial, depending on what we've discussed at that point. So say, for example, if I'm discussing a really difficult I don't know, a serious incident that's occurred, or maybe a really unfortunate death that has occurred, I might do some supervision with 3 or 4 people, and I would class that as clinical supervision for those people, as long as that's what they feel that they've received as well. If it's managerial supervision, it could be how do we manage the team better, or how do we manage the workflow better? And that would be a team having a discussion about how do we work better. And again, I would put that under the heading of managerial. So all of those things have the ability to be captured. But when it comes to ring fencing time for the teams, I think that's very, very much for the wards, the teams themselves, the service managers, the operational managers, to make sure that staff see it as important and value it. Because actually, those are often the first things that get taken away, aren't they? When times are tough, development and supervision is the first thing that often goes, and that's what we've got to build back in, is that actually it's really important. It shows how we value our staff when they come to work. So I haven't got an answer for the last bit, but it really is for me to say, I'm putting out that plea. It is important. We see it as important. We've developed a system to ensure we can capture it, but actually let's get it back in there.
Thank you ever so much, Anne-Maria. That's great. Thank you. And we've got 1 minute left, and we've got 1 question left. So I don't know who wants to volunteer for this. But Jenny's asked, what do you find is the most important thing for you to be able to do your job day to day? Silence.
1 word answers only, is it?
Absolutely.
Beer.
Not so bad. I'll tell you what mine, because he's been mischievous today. I'll tell you exactly what mine is. Good diary management. We looked at it. Did you see him roll his eyes, Yolanda? He rolled his eyes at that answer. That's a very good answer. I tell you what, if you don't get good diary management and you're running around and you've got to be somewhere and you can't, well, honestly, it puts you into a kind of like stress, a position of stress.
That's great. Thank you ever so much, Anne-Maria. And
yeah, I'm the only sensible one here at the moment.
Yeah, I thought, sorry, but Yolanda putting a head in her hands at that point when John said beer. That's fine. Is there anything that Sarah, Julie would like to add to that, or is there anything at all that you would like to say before the end of the meeting? Thank you.
I personally can't do the job without the people that I work with. They matter more than anything. My diary is a mess, so I can't speak on that one. Yeah, I'd just like to acknowledge how busy clinical services are, and thank colleagues for their ongoing work, particularly the acute pathway is very, very busy. So just to highlight that and to say an absolute thank you.
Yeah. Oh, Sarah, go on.
Well, I put it in the chat actually. So my thing in the day is about having time to listen to people. One, because I think it really grounds us all about why we come to work, and to offer the services we offer. And two, I think just to help problem solve. The little things in the day that drive you bonkers. So for me, it's having time to hear what people are saying to me.
That's great. Thank you ever so much. Just to add, Mark Howes has put into the chat, thank you, John, for your authentic leadership, reminding everyone it's important to keep hydrated to improve performance.
It'll go far, that, Mark Howes. Thanks very much for my outrageously glib comment. But no, a great conversation today. To echo those comments around thanking everybody for what you're doing. The pandemic is passing, but there's a shed load of work ahead of us, and do really appreciate everybody's input. Spread the word about the Q&A. We're going to be continuing to do it. We might be changing the frequency, but more of that anon. But a really good session today. Thanks very much, everybody, and have a good day.
Thank you.
Bye.
Bye.